Sex education is needed in high schools. There is a need to teach young people about their health and safety. The skills young people develop, also as part of sex education, are linked to the skills they're needed in life. A 2011 Center for Disease Control survey indicates more than 47% of all high school students say they've had sex. 15% of students have had sex with 4 or more partners. 60% report condom use and 23% report birth control pill use in the past 3 months prior to the survey which they last sexual partners. From the CDC, the teen birth rate has declined to its lowest level since the data collection began. The United States still has the highest teen birth rate in the industrialized world. One in 4 girls will become pregnant at least once by their 20th birthday. Ages 15 to 24 represent 25% of the sexually active. Half of all of the new STDs, 9.8 million cases a year. 3.2 million young girls are infected with at least one of the most common STD, HPV. HPV is a common STD among teens. 35% of teens 14 to 19 have HPV. Girls 15 to 19 have the highest rate of gonorrhea, second highest of chlamydia of any age group. Males also get STDs. The infections go untreated and undiagnosed because they are less likely to report symptoms or go see the doctor. In 2000, the cost for treating sexually transmitted infections was $6.5 billion. Excludes costs for HIV and AIDS. Many teens infected with HPV don't ever show signs. This is why HPV is so easily transferred. HPV in women can cause warts as well as precancer and cancer. It is rare for men to show signs of HPV. They can still contract genital warts when infected with HPV. 75% to 89% of all males and females in the U.S. will contract one or more types of HPV. Each year, 800 men become infected with HPV. About 1,100 men contract HPV, get anal cancer each year. Abstinence from any kind of sex is the only way, 100% sure way to prevent sexually active teens from contracting, spreading HPV. From Kids Health, latex condom use is another effective way to prevent HPV. Although it's not 100% effective, both males and females can spread disease through any kind of genital contact. The number continues to rise each year for the number of teens who are infected with HPV. To cut down these numbers, safe sex, frequent HPV testing, vaccinations, and some of the best measures sexually active teens can take to protect themselves from HPV. Who uses condom since? Couples who are responsible stop and put on a condom each time before they have sex to prevent against STDs. Condoms are the only method of birth control for men. Also allows the male to take control of responsible birth control and STD protection. Condoms are available without a prescription and are sold in drugstores, supermarkets, even vending machines. Condoms come in different sizes, textures, and colors. Condoms are the least expensive and most available method of birth control. Male condoms cost about $50 to $1 each. Female condoms cost about $2 to $4 each. Many health centers and family planning centers like Planned Parenthood and some schools give condoms out for free. Now, if you think condoms are expensive or birth control, you'll spend about $10,000 on your baby's first year, according to thousands of moms who took Baby Center exclusive survey. 40% of the moms said having a baby costs a lot more than they expected. Being prepared to shell out for diapers, food, gear, clothes, toys, childcare, and healthcare, and there are many other hidden expenses.